And our presenter for today, I'm excited to introduce Nathan. Nathan has been a therapeutic foster parent for 17 years, specializing in early health childhood traumas. Nathan's current role as a board of director at Webmaster for Male Survivors involves oversight of volunteer staff along with the daily operations of the website, which oversees over 100,000 visitors and 2.5 million page viewers annually. Additionally, Nathan provides training and resources for caregivers in Washington State. Nathan, the floor is yours, and thank you for joining us today.
Oh, thank you. Thank you for having me here. Always great to be amongst amazing people doing amazing work. So, as you said, my name is Nathan Lasheen. I use he, him, his pronouns, and I'm with Coordinated Care. If you're not aware, Coordinated Care is the insurance provider for the kids that are in foster care, alumni, and post-adoption, and we have the refugee minor program as well. So we cover a broad range of youth that are system involved right now. So as we go through this is just a good high-level overview. I will make sure you have my contact information and the contact information for our organization's support team. So the big thing as we run through all of this, please utilize the Q&A. If you have any questions whatsoever, put it in there because I want to answer your questions. Caveat to that is that I work on the education team. I am not a insurance person that can answer all the questions, so I might have to get back to you on those, but we have an amazing team that you can actually call in or email 24/7 with any questions or concerns that you have. So let's jump into our presentation, folks. Hey, look at that. All right, technology worked great for us this time around, folks. All right, so as I said, I'm here with Coordinated Care, and we are here discussing all of the benefits and program options that are available that we want to maximize with our members. So before we get started, though, I do want to do a tribal land acknowledgement because we are on tribal and ancestral lands and that there have been people here from time immemorial. There's 29 federally recognized tribes here in Washington State and many more bands and groups that are fighting for their rights to be heard. We want to honor them, we want to see them, and we want to uplift Indigenous voices when and where we can and partner and be one community with them. So people ask me all the time, kind of what is Apple Health? Well, it's a Medicaid program, so it's funded by healthcare services in dollars. We are jointly funded by federal and state governments to cover our members. Nationwide, there's roughly 69 million enrolled nationwide. Here in Washington State, we have roughly 1.7 million that are Medicaid. Those numbers do fluctuate. We did see an increase during COVID of having more Medicaid members joining the ranks while we were through COVID, and now we're kind of seeing a decrease. So do bear in mind that 1.7 million is a 2016 number, so little old. So what does Apple Health, how do we do it? What do we do? So again, we are administered with state government, and then we also have a lot of federal rules that we have to follow. So big things of what we cover. So we're covering all of the predefined healthcare services that are eligible for the payments within our network. So we cover a lot of things, everything from, behavioral health to our mental health services, substance uses, also physical. Also, we cover a variety of services that are available. So anytime a member is unsure of what services are covered, they can literally call the 844 number, which I'll show, and they can email us as well. So you can literally have your the member or the caregiver actually email in 24/7 a day, and it goes to the same care team that answers the phones. So even if we're closed, you can still email in. So it'll be in the queue for first thing in the morning for them to look at and get response to. We want to give choice as much as we possibly can, right? So whether that be through finding additional providers within the area, growing and expanding our network. We also are very big about our centers of excellence that we are opening up throughout the state of Washington. And those are highly trauma-informed services that are provided through practitioners at local centers of excellence. So we'll go out, like I was just at one, and I actually train everybody from the front desk staff all the way up to the doctors, because where is that first interaction? On the phones, right? As somebody comes in to the clinic. So that's why we start with everyone there, because we understand that going to a practitioner can be a challenge, right? It can be very triggering for some of our members. So we want to eliminate that. So we provide abundant services and choices when and where we possibly can. So the payments, we can do, states do pay the directors directly, what's called fee for service, or they can pay one of the 5 managed care organizations here in Washington. And that's what we cover. We're one of the 5, and we do the managed care of it. So big thing is that HCC should never receive a bill. Services are billed through our coordinated care or the provider one. So we will help facilitate those as well. Also, our members should never receive a bill directly. All right, so what is Washington Apple Health? Well, as we look at it, so it's a year-round enrollment. It can change plans every month for the continuation of care and to be one of the best and most appropriate plans for our members. So all family members have to be in the same plan with it. There's currently the 5 managed healthcare plans throughout the state of Washington that are available. So how do you apply? How do you find out? Well, that's using the WashingtonHealthPlanFinder.org. It's been out for many years. It's also referred to as the marketplace. So that's where you can review options, see all the other choices that are available, and what works best for you and your family. There are some requirements to be able to apply. So income requirements, we have to have Social Security, date of birth for everybody, all of that information. So just like everyone. So fee for service. So sometimes, anything to do with the government, we love our acronyms, right? So FFS is a payment model where providers bill the healthcare authority separately for each service that they're providing. There actually isn't a health plan coordinating with the providers or the patients. So each patient is actually on their own to find the providers and navigate the system. So this can be a little more challenging for some of our members, which is why we manage that for them. We also coordinate of benefits to ensure that when they're seeing one provider, that information gets over to their new provider. So again, some of the fee-for-service benefits that are covered under the Apple Health program is going to be that long-term care, going to be dental services, also eyeglasses and the fitting services for children. So we do have some value-added benefits around eyeglasses that are launching this coming year. Very excited about that. Transportation. A lot of people do not realize that there's actually transportation benefits to and from appointments. Right? So please encourage them if they're having transportation issues because they're just too far off the beaten path, they have bus route issues, right? And they're having to travel, transportation services are available. So again, we also have the early supports for infants and toddlers. And then we also have the fee for service for pregnancy, termination, sterilization, and our transgender benefits are available as well. All right. So this is where we shine. So managed care is a healthcare delivery system organized to manage cost, utilization, and quality. Big important things right there is really going to be that quality and that experience that members are experiencing, where they might see one doctor get a battery of tests. That information might not go over to another doctor after they've moved, right? So we want to coordinate those benefits, coordinate those services. We want to make sure that our members aren't doing duplicate tests or not having medication interactions, all of those things, right? So that's where the managed healthcare really comes in and can really shine. So Medicaid managed care providers deliver the Medicaid health benefits and additional services. Everything that we have is going to be through the state contracts. And then we have our additionals, like what we call our value added benefits, like all of the trainings that I provide, all of the incentives or the My Health Pays that we'll talk about as well. So if anybody is really looking to learn more about what are the options out there, biggest thing is just remember the WaHealthPlanFinder.org. That takes you directly to the website. It's ran by the HCA in the state of Washington. You're able to look at all the plans and all the options. So let's do a deep dive of coordinated care now. So kind of going forward now is going to be all about coordinated care and the benefits that we directly offer our members. Right. So roughly in the state of Washington, we have about 25,000 members that we are covering and supporting. So all the way from just coming into care to the extended foster care program. Very excited that we even cover the alumni of foster care now. So we're able to cover the kids up until their 26th birthday. We're able to also support when the kids reunify with their families of origin. So once that dependency closes, we're able to cover that youth for up to a year. So that way, during that transition period, that family of origin, it's not having to figure out a new doctor, new pharmacy, new medication. What was this? What was that? Right? We're able to help support them through that all the way for up to a year after the dependency closed. So if they have retrial turn homes, first time it didn't work out, kid comes back into care, then they go back home, only starts that 1 year clock after the dependency has been closed. Okay, so this is what our card looks like. So this is going to be the card that we're going to reference member ID number. So when you call into us or when you email into us, we usually ask for that member ID number. So that's available right there. Also, the Medicaid ID number is there as well. We can look it up from the Medicaid ID number. So that's what our card looks like. Those get mailed out when kids come into care. If a caregiver needs to request another card, they simply just call in and they can have it requested over. We also have the ability of sending over a PDF copy of the card as well. So if a caregiver would like a digital copy of that card while they're waiting for the physical, the social worker can reach out to us via email. We can email it over. This is almost all of our benefits that we are able to cover. So we provide coverage for the medical services, the standard visits. We also cover urgent care. A lot of people aren't aware is that we provide urgent care coverage as well. So it's also a great ability of being able to use our nurses advice line to find out, do I really need to go to the ER or can I go to an urgent care for that support, right? We cover the vision eye exams. So we cover the exam. The glasses are covered through the fee for service. So we just do the exam portion of it. We don't do what's called the hardware benefit. We cover the prescriptions. So on prescriptions, big thing to let caregivers know is that if the doctor writes on the prescription pad a prescription that's what's called over the counter, where you can get it in the pharmacy area, you can have the pharmacy take it behind the counter, fill it behind the counter. You're still going to pay the same price for the item, but because now it's a prescription base, you don't pay the tax on it. So for somebody like me, that's a therapeutic foster parent, and all of my kids are on multivitamins. Some of them are on melatonin, and having to buy those every month. That savings of just having it become a prescription and not paying the tax really adds up over time. So just remember that. Oh, looks like I got some questions here. Let's take a look. Should youth have 2 cards for medical benefits? So are you talking about they'll get a provider 1 card and they'll have our card? Any of our members, when they're accessing our services, can just use the white card. The provider 1 can be used for dental, but we put the Medicaid number on our cards as well, so they can look them both up. And then part 2, 1 card of blue Medicaid and 1 coordinating card. Is there any age they need to apply and have both? So as soon as the dependency is opened up, they're automatically enrolled into the coordinated care. We're the MCO for any of the kids that have open dependencies with the state of Washington. So they'll automatically, that triggers it at the healthcare authority to mail out those cards. And that's easy peasy to get the cards. If they go, say, to a new caregiver and that caregiver doesn't have any of the cards, you can call in on the generic 844 number, which I'll give everybody, or you can email at the brand new email address that we signed up and set up for everyone, and you can request new cards to be mailed out to you. The big thing is that I want everybody to remember is that if you have any medical questions, call us. Let us help try to answer the questions for you. If it's something we can't do, we're going to usually have a direct number for you, or we'll be able to do a transfer over to that correct department. We'll be able to help you navigate it. So best thing you can remember is just reach out to us and we'll help get you to the right place. Okay. So some of the other benefits that are really important are going to be the emergency room visits. Those are covered. Again, highly recommend looking at being able to use a service of calling into the nurse's advice line, finding out, should I just go to urgent care or do I really need to go to the ER? Because sometimes, if you go to the ER, you might be waiting a long time. Physical therapies, specialized therapies are covered. Also, family planning is covered with us. We also have a fantastic program called our disease management program. So what we're seeing in my example is I have a kiddo that's type 2 diabetic. I'm diabetic, so I know how to manage it and how to encourage my kids about healthy eating and habits. Say I didn't know that as a caregiver, you can actually have one of our disease management specialists call that caregiver and the kiddo, set up a time to go over, this is your medication, this is why you check your blood sugars, these are some of the things that can impact it, these are some of the things you want to stay away from. So we provide that for several different diseases, but primarily we see a lot of it for asthma and for diabetes are the big ones that we see, and we have that service available. Gender affirming care is something that we also have services for. And then also any of our substance use disorder treatments are covered as well. All right, so if I can encourage anyone, this is the one and most important slide that's available because it has our 844 number that I keep mentioning, and it has our new email address. So we learned 2 reasons to have that email address. One of them is that a lot of caregivers find it, sometimes challenging to have to make phone calls and get connected, and they're just living a busy life, right? So why not have an email address? That email address literally goes to the same call center people that are there to support you. So it's a great way of being able to get that information to us. Say you had a late appointment and you had questions, you're looking for a specialist or for a referral, email that AHCC team. The other great thing is that a lot of our older members, our teens, find it challenging to navigate and call, and sometimes just talking to a provider can be really challenging. They can use that email address as well and ask their questions and get the support they need via email. So this is available 24/7 to them. The team works traditional Monday through Friday hours, and they will respond usually same day, but if not, they are contractually within 72 hours, but usually it's same day in my experiences of when things are coming out. That one's done. That one's done. All right, just keeping up on all the questions. Amazing, folks. Please keep using the Q&A as questions are coming up for you. So if you are looking to help them find their providers, you literally can go to our website, click Find a Doctor. That's how easy it is. Say that's not working for you, you're running into more challenges, you can call in on the 844 number. If that's not working and you're like me and you have multiple kids and you're trying to navigate everything, I use the email address. Hey, I got a referral for this specialist. I need help finding one. Our team can actually call around to local doctor's offices, find out what the waiting list time is. So I'm not saying that we're able to sneak you in or get you in any quicker, but what we can do is we can make those phone calls and try to find a provider that maybe is taking patients immediately, or maybe has a shorter waiting list. So leverage us. Let us make those phone calls for the kiddos and the caregivers. All right, so pharmacy benefits. So we cover, so many of the over-the-counter medications are covered with that doctor's prescription. So remember what I said earlier is that if you have the doctor write the prescription out on a pad, the caregiver can turn that in, or the member can turn that in directly to the pharmacy, and then the pharmacy takes that medication from over the counter to behind the counter. That way, then they don't have to pay the tax on it. So that can really add up over time, especially if you're looking at some of these that are on a consistent basis, right? Also, any of the delivery device for the medications is a covered benefit. So sometimes you'll get the prescription will be written for a medication, but you need compounding or you need to use an injectable, and it gets denied because the doctor didn't fill out the prescription right, or there's some challenge at the pharmacy, they're not processing it or using the right code or whatever that is. We have an entire pharmacy team that can help support the member in getting their medications and the delivery device covered. So if you're like me and you have diabetic, you have to have the test strips, and I have to have the needles for it. I take an injectable, I have to have my needles and those are 2 separate prescriptions for it. Those are covered. All right, vision benefits. So 20 years or younger, they're going to get that eye exam. So that eye exam is going to be the refraction for a glasses prescription only. That glasses prescription can be used to then turn it into what's called the contact lens fitting, but contact lens fitting is not a covered benefit with us. The hardware benefits for the glasses and the lenses, that's provided through Provider One. So that actually is an amazing program. And those, so what I really recommend and what I do is my kids, we all get their free pair of glasses, and then you can usually go on websites and order the glasses for just to have a little bit more style and fun with it, right? Very excited that we are going to be having a new eyeglasses hardware benefit for the first time. So we'll be discussing that in more depth after January 1st. So stay tuned. We are actually going to be providing a glasses hardware benefit for youth. So stay tuned. I'll be able to talk about that more next year. So if they are alumni of foster care, 21 and over, up till age 26, they get one eye exam refraction every 2 calendar years. So they would be able to access any of the eye doctors within the network. You do not have to have a referral. And then any of them medically necessary. So if they have to have an additional exam, if there's the refraction and now they have to do something like a dilation, visual field, or there is other concerns, that would be covered by us as well. So again, you can connect on the website to find an eye doctor. You can use the 844 number, or they can use just the AHCC team email address, whatever works best for that member or caregiver. All right, so our behavioral health. So our members, we don't require that they get a referral from their primary care physician to seek mental health services. So a couple of things we all know coming out of COVID, what did we learn? Huge shortage, right? It's waiting lists for almost every type of mental health services. It's waiting even for crisis intervention services. So, we know that there's challenges out there. What I want to encourage everybody is if you're on a waiting list, call in to our care team or email them and ask them, I'm on a waiting list at this doctor. This is what we want to see. Is there maybe somebody who has a shorter waiting list? Right? I'm not guaranteeing that we're going to be able to find somebody who can take you immediately, but let us at least try to do some legwork for you. Let us call around. Let us, see if there's something more that we can get you in a little bit quicker. Maybe if you, put in your email, hey, I'm willing to drive 30 minutes, one direction. If I can get, the kiddo or member in sooner. Okay, that gives us a radius. Now we can take a look, see who's there. We can make some phone calls, emails with the providers and see if there might be something that's a little bit shorter wait time. So please give us a call. We can also help of arranging of the transportation benefits that are available to our members as well. So again, they don't have to always rely on people to give them transportation or the bus routes, right? Let us take a look and see what transportation options are available and help get those scheduled and coordinated for you. Right. So behavioral health benefits, again, kind of talking about those wraparound services. So caregivers, especially foster parents, were pretty familiar with the WISE services. So that's the wraparound intensive services. Those unfortunately do have waiting lists right now. So that's where you can leverage coordinated care, call into us, email us, see if we know of a place that has a shorter waiting list and we might be able to get the kiddos in sooner. For the PACT as well. And then what I am really happy about is that look at our substance use disorder treatment. We cover inpatient, outpatient, residentials, detox, even the medically assisted treatments, right? Those are covered benefits already that our members have access to. Right? So AHC members are also covered for some of the followings. So this is through the Provider One fee for service. So again, those long-term cares, the eyeglasses we already talked about. Most of these services we've already covered once or twice before. So again, let us call into us. We can help you navigate it. We can tell you if this is covered through us or is this covered through the Provider One fee for service. Let us help coordinate and support. That's what we're here for. Right. So non-emergency medical transports. So these are going to be through our regional brokers. They change from time to time. So like where I'm from, down in the Pierce and Mason County areas, the big one that we used to utilize a lot is paratransit. That's where they actually send out a professional driver and a professional vehicle to help make those transportations. So that is available service. You can look them up on the regional brokers on this website. You will have the slide deck. So please do not try to scribble down that website address. Again, you can literally just email our team and ask for, hey, can you send me the link for the regional brokers for transportation? And they'll just send it to you, right? Let us help support you, right? So out of all of our slides, again, this is the most important one. So that 844 number, you hit option 2, gets you right over to our dedicated care support team. They are phenomenal. They do their very best every single day to try to coordinate, figure out what the errors are, how can they support you, right? Healthcare is complicated, right? None of us have all the answers. That's where leveraging a team like coordinated care can come in to be so critical and can make that medical experience better. So please use the 844 number, option 2, or you can use that email address. Highly encourage using the email. It's a great way, especially for kind of every generation is starting to really prefer what? Texting, right? Emailing, right? Leverage that. Let them, hey, here's a way you can also get all of your questions answered through email. You can even schedule a follow-up call through email. So then our team calls that member or that caregiver back when it's appropriate and beneficial for them. All right, so we talked some of the value-added benefits. So we're going to jump right into this. So the value-added benefits are amazing, lots of options. So for our members, right out the gate, we have our care management. That's our standard. That's what everybody gets. But we also have some things that a lot of people aren't aware of. So we have our Boys and Girls Club membership. So that is statewide. So Coordinated Cares already have that partnership with the Boys and Girls Club. That's a covered benefit for them already. We have our rewards program, our My Health Pays. So that is where we literally pay our members for doing routine services, getting their immunizations, right? So we cover that as well because we want to encourage our members. We have learned the more that they access services on the front side, the more that they're getting their annual screenings, getting their immunization records, getting their flu shots, right? The better their health outcomes are later in life. And that's the key to it, right? We want to improve the health outcomes of our kiddos. This is one of the ways we do it, by financially rewarding them. They can call in and get their Visa prepaid card sent to them. They can use it for almost anything. It cannot be used for any alcohol, tobacco, firearms, ammo, any of those things. But we've seen our members use it for everything from their cell phones to their Netflix accounts. I mean, we've even seen people use it for their PlayStation and Xbox account fees. So that's available. We have the Healthy Kids Club. So that's where our Cece the Panda, she's our mascot. So that's actually available to any Washingtonian kids under the age of 12. So that's where they would register with our club online. They would then get snail mail, coloring books, activities, birthday, little happy birthday things. And then they get the reminders about exercise, eating right, all of those great things. So that's available statewide. Smart Start for your baby. We have that available for all of our members as well. So if you're working with any members that are pregnant, we have this so we can actually already get them the car seat, the breast pumps, and more services and programs right out the gate, because we want to support that new mom and that new family. We have the amazing 24-hour Nurses Advice Line. This is absolutely amazing because it's for the caregivers or for the members. It's 24/7. You can call into the Nurses Advice Line using that 844 number, right? That I hope everybody took a picture of that slide. You can call in and find out, especially as a caregiver, like, is this something I can just give Tylenol or Advil or ibuprofen for and wait till the morning? Or do I need to really take this kid to the ER or emergency room, right? Fantastic resource. And that is available free of charge to all of our members and the caregivers for those members. So this is the My Health Pays. This is that program I was telling you about. It is phenomenal. You can request this. So the cards do get mailed out after the first, if they go in and they have their annual or they have their flu shots. After that first event, it'll trigger the mailing of it. The cards can take 6 to 8 weeks to come. So sometimes by the time the card's gotten to the caregiver, the kiddo's already been moved or already returned home. That's okay. You can literally call in and request the card get mailed to the new address, right? So that is totally available. The great thing is that that card will be the same card every time they have a qualifying event, right? That comes automatically. So the kids can use it. It's a Visa card. It's their card. So here are the breakdowns. Hey, look at that. Great job to my team. They even updated it with the new ones. So starting 12/1. So the annual well child visits is now $40 that we put on that card. Look at that. We now increase the flu shot to $25. We now have doing the health screenings, $25. Prenatal visits, postpartum visits, $50 and $25, right? We also offer the breast cancer screening benefit now is a brand new one. Cervical cancer screening is a brand new one as well. So I absolutely love, this is the newest benefit that I am just enamored with. Follow up after hospitalization from mental illness. So we know that there are times that our members are being admitted to hospitals, being admitted to mental health wards. And what we want to do is, again, encourage them and support them in their journey. So when they come out of those facilities within the first day, so the day after they get released, up until 30 days, if they make their appointments with qualified mental health supports, they qualify with WISE, they are taking care of themselves after they've been discharged from the hospital, we're going to put another $25 on their card, right? Diabetes. We know, unfortunately, diabetes is running high within the foster care realm. So we have a new benefit for comprehensive diabetes screenings. We have learned one of the great motivators for members, money, right? And I'll be honest, money's a good motivator for me as well. So I get it. Oh, all right, so we had a question about people applying for the card and not getting it. The card can take a significant amount of time to show up to 90 days. It's usually 6 to 8 weeks because it came, that My Health Pays card is a corporate program, so it comes out of the corporate headquarters, not the state. Here, if they have not gotten their card and it's been over the 8 weeks, have them email in, or they can call into the 844 number. The call center staff's actually able to log in and look at, was it sent? Did it get sent to the wrong card? The wrong address, and that can easily be rectified. Whatever funds that they have already qualified for and that's been on there, it's still going to be there for them. So don't worry about that. If they haven't gotten the card, the funds are still there because they've earned them. So just call in or email in. Oh, another question. Gosh, yeah. Oh, thank you. Thank you for the question. That was a great question. All right, another benefit that we have. So this is our Harvest Bucks program. So this is available to all of our members. It is a $10 voucher that you literally take over to Safeway. It has a barcode on it. You get your $10 worth of fresh frozen canned fruits or vegetables, and you just scan it at the register and it takes it off. So this is an amazing partnership and program with Safeway and Department of Health. This is available for all of our members. So even our members that are in group care centers, our members that have returned home, they qualify for these vouchers. They're $10 a month, up to $100 per member per year. So they do have an expiration date on there. So I would highly encourage, I've been telling everybody I run into, take a look at when it expires, because a lot of them expired at the end of this month. We want to make sure they get utilized. So you can literally request these simply by sending an email. So you can either call in with that 844 number or just email foodrx@coordinatedcarehealth.com, or you can just use the generic email and they will forward the email off for you. So this is a phenomenal benefit. It's 10 of these $10 vouchers per member. So if you have a family that has 3 kids, they can get 1 voucher for each of those kids every month, right? So we utilize these to really help our kids be able to write their own shopping lists, and budget is how we utilize these with our teenagers. It's been fantastic. It's really empowering. It lets them make their own choices for what fruits and vegetables they want. And it really helps talk and start that conversation. This is why you don't just eat a TV dinner, right? This is why we got to have those fruits and vegetables. So phenomenal, phenomenal program. Super easy. And even at Safeway, you can use multiple coupons on the same transaction. So you don't have to do all these separate transactions. You can do them all in one transaction. So fantastic program. This is exactly what it looks like. Fresh, frozen, or canned. Has to be no sugars or salts added, okay? So fantastic. Please make sure everybody knows about them. This is another amazing program. So our foster care centers of excellence is something that we're really proud of. Oh, another question. Let's see, what do we got here? Yes, everybody will get a copy of this presentation. So our foster care centers of excellence, currently we have 3 of them. We will be announcing probably in Q1 our 4th one that's going to be opening. Our goal is to have 1 in every region, and then we want to have multiples in every region. So what we absolutely love about these, and I use one of them as a foster parent myself, is that they are highly trained, they are trauma informed, they understand restorative justice. They are just fantastic, and they work with our systems. They work with the caregivers. They're able to help navigate. They just do a phenomenal job. We see better outcomes when our kids are going to these centers because it's so much wraparound supports and services. So currently, they also allow, so as us caregivers, if you've ever been a foster parent, you know what I'm talking about when I say, hey, sometimes kids come to you and you have like 3 days worth of meds. Our centers of excellence specifically keep slots open so they can get us caregivers in sooner, so we don't run out of the medications for our kids. Now, currently we have 3 centers of excellence in the state of Washington. here are our three. So we have Harborview up in Seattle, Excelsior out in Spokane, and then we have Community Healthcare Foster Adopt Clinic here in Tacoma. We do have a fourth one that we are finishing up everything, and they should be able to announce and launch in Q1. So I'm super excited to have another one and another location. They're in a rural part of Region 6. So very excited to have them on board. Another fantastic program that we actually started this program right before COVID. Guess what? It was a highly utilized program. It's our Teledoc program. So with Teledoc, just like the nurse's advice line, it's 24/7, right? So our Teledoc, you can actually call in, you can use the web platform, use the Teledoc services to get referrals for non-emergent issues. You don't have to travel, you don't pay an additional fee. They can even prescribe. So we were seeing this really for like dermatology. If you've ever had a kid that's at a member, it's at a referral for dermatology, that can be months out. Teledoc, you can actually use Teledoc, take pictures and videos in the impacted area, Teledoc with the doctor, and get prescribed for the medication and cream to help support. Another question came in. So any of these programs, as long as they are under the official unaccompanied refugee minor program and they're our member, they get all these benefits as well. All right, so to access Teledoc, it's literally teledoc.com/coordinated care. And we've also ensured that it's mobile friendly. So if our members want to use that as well, it is available to them 24/7. So you can use it for, again, those basics of like the colds, the flus. Is this something I should take the kid to the doctor? Is this something I can just give them, Tylenol, Advil, right? Upper respiratory infections, also for smoking cessation, rashes, big one. And then for any of our members that are over 18, they can actually use our Teledoc for behavioral health services. So if you have any members that are 18 up, they can use our Teledoc and not even have to leave their house to get the support and services that they need and want. So it's a fantastic program. So we have our adolescent to adult program. That's where we do our outreach. We are attending the 17 and a half staffings as well. We're trying to ensure that before members hit 18, they know of all the tools, benefits, and supports that are available to them at all times. We also have the adoption success. So that is where we don't end our support right at adoption, right? You can still keep coordinated care. Also, we have the benefits of when the kids return home. They're not immediately removed from our rosters. We're able to provide them services for up to a year. Family doesn't, in the middle of this transition, doesn't have to now figure out a new doctor, doesn't have to figure out a new pharmacy, doesn't have to any of that stuff, right? They can stay with us. We also are suicide prevention. Our suicide prevention protocol, we actually have this. It started here in Washington State, and we actually have this that we do the assessments with our members and just any support and services that we can provide and support, and also getting them, especially for our higher risk ones, getting them into services sooner than later, reaching out to the caregivers and the support team. Right. Again, the other programs that we have for our alumni is the SafeLink cell phones. So this is for any of our members that are 18 plus. We can actually provide them a cell phone. So it'll have minutes, data, unlimited texting. So it has all of that available. And then they also have, of course, the online account access, so they can take a look at all of their benefits, all of their claim histories, and contact information. So that's available for them as well. Right. So again, what can we do? We can do all of these and so much more. We can help you find a provider. We can assist you with getting scheduled. We can help manage, especially complex medical needs. We can help you if you're going in and our members are going in for multiple different issues at different. So if they go to an urgent care, then they go to an ER, then they go to this doctor, they get a referral, right? Keeping track of what were they seeing for? What medications are they on? What supports do they need? Are they getting duplicate exams at different places, right? That's where we can help support, helping our members understand, especially the chronic diseases. We have our disease management support team that can help the member and the caregiver. We can also help access home health care and the durable medical equipment, get medications when and where it can actually get mailed to the member's house at no charge. big things are going to be also is just reconnecting them to community-based resources. What supports and services are available? How can we help coordinate those? How can we get you in touch with them? Can we email you a list within your area? Do you want us to try to help make contact with them and find out what is their intake schedule, right? We can do all of those things. Our members and our caregivers just need to call in or email us. Also, the big thing is that we can help with providing safety planning and suicide prevention as well. So again, that started here in Washington State with our program, and it's something we're really proud of because it's actually gone nationwide with our other insurance carriers that we are in different states. So again, most important screen. If anybody, this would be the one to take a picture of, screenshot it, save it, because you can literally call in the 844 number, or you can email the AHCC team at coordinatedcarehealth.com and we can support you. All right, so how can you get in touch? Who contracts who? Where do you go for all those updates? All of these great things. So here is the Healthcare Authority Contract Manager. So we're always accountability and transparency. This is my supervisor, Maureen. Coordinated Care Vice President Medicaid is Kelsey. This is her direct email, and then DCYF Contract Manager. So you will have all of these contact information in the slide deck that you're able to access. So don't worry about trying to write it all down. You'll have all of this. I can tell you, everybody in our team, as soon as you email them, we try to be a one-stop solution. So we're not going to bounce you around. We're not going to say that's not my department. We are going to take care of you. We are going to answer any questions you have and get you connected. We offer lots of free trainings as well. So when you get the slide deck, highly encourage you to take a look at our, this is the events. So I actually, myself and my counterpart, Zia, we do free community-based trainings. Usually we do anywhere from 1 to 6 trainings a month, every month. They're web-based, they're open to the public and anyone. So they range on topics from suicide prevention, substance use disorders. Right now, our most popular one is dealing with holiday stress. Right? We have working with families of origin. We have secondary stress and self-care, right? We all need a little self-care. So these trainings are available to you. They're available to the caregivers. They're open to the entire community. So I'd encourage you to take a look at our calendar of events that gets updated on a regular basis. And we do, like I said, between 1 and 6 events every single month. So please take a look at them. The Apple Health Core Connections, that is our actual website. So that's AHCC, Apple Health Core Connections. You can go there to see what other events we're doing and what other in-person stuff, but you can also get contact information. That's where you can also find a provider and get connected with us. We have 2 separate programs and responsible people that work with our the caregivers, work with primary care physicians, and work with DCYF. So you have the AHCC liaisons. They're tasked with directly supporting all the DCYF staff and helping facilitate and provide support when and where needed to help, especially for some medically complex issues or challenges that a caregiver member is facing, or even social workers coming up against. We are there to help support. So you'll have all of our AHCC liaisons contact information is in the next couple of slides. And then you have myself as one of the amazing, the fabulous community educators. So I'm one of the, myself and Zia are the ones that are out in the community. We do in-person events. We also do the online trainings. They're all free and available. You just have to reach out to either one of us, and we are more than happy to schedule them. So we can do it for everywhere from primary care physicians to the WISE teams, to therapists, to CASAs, to JR staff. I've even done these for prosecuting attorneys associations and victim advocates. So these trainings are free and available for all. So again, here's this Apple Healthcare Core Connection number again. And then if you have any questions about the adoption support, here's their direct number with the extension and email. You'll have all these in the slide deck. So these are our liaisons. So we are the statewide program. So you have regions 1 and 2 are covered by Michelle. Christina covers regions 3 and 4. And then our senior liaison, Jen Estroff, who is actually out on maternity leave right now, is covering 5 and 6. So we are available to support you any way possible. Our community educators are myself and Zia. That's my direct email addresses. I can give everybody my cell number when this looks like when this slide was added. It was before my email, my cell got issued. So please reach out if I can ever partner with you on any type of training events. If you need any support, you can email myself or Zia, or you can email our generic communityeducation@coordinatedcarehealth.com. And we're able to talk about what educational options we have and available currently and answer any questions you have. And then we can even schedule them for virtual and in person around your all schedule of what works best for you. So we work nights, we work evenings and weekends. So whatever we can do to get this information out there, we want to do it for you. All right, amazing folks. That's what I have for you all. So we've got about a little over 10 minutes left. So I want to open it up using the Q&A. Please, what questions do you have? What didn't I answer? What did I cover too quickly? What can I do to support all of you? Please put it in the Q&A section. And while those are coming in, I am going to put my email address in chat for everybody. Seriously, please reach out to me, reach out to the AHCC team. If there's anything we can do to support you, we want to. We want to make this a better experience. We know healthcare is complicated. And here's my cell number.
And Nathan, there is a question on the chat. I don't know if you have addressed it, but I'll just read it out loud.
Please.
How would getting a new copy of a card for an unaccompanied homeless youth if the address in the system is not safe address for them to access?
I would get a digital copy of the card then, so they can call in or email in. And I would hope they would have somebody that they can use their email address, or they have an email address on their phone, and they can get a PDF copy of their card.
And there is another question on the Q&A as well. Is the access the same for a refugee as well as McKinney qualified for accompanied homeless youth?
It's a little bit different on some of the qualifiers. So I would highly recommend, Tammy, is you can call in to our AHCC team and they can kind of take a look at that, see if they're already in our system, or see what the qualifiers are going to be. Great questions, folks. Any of these questions around support and services, always just call into us, because even if we're not the right person, we're probably going to have resources and be able to get you connected to the right person, department, or we're going to know about community-based resources that can support as well. All right, so, and then folks here, again, that's the direct 844 number, or that is an email address. Highly recommend saving it, utilizing it, give it to any of the members. However they want to engage with us, we want to be able to support them. All right, I see another question here. Not sure about having the two cards. So the My Health Pays card, that's available to any of our members at any age. So it's not like one of those they have to call in before they turn 18 to get it, because we'll still issue it afterward, because it's their card, it's their benefits, their rewards. The only thing I'm aware of with 18 is that if a kiddo is enrolled in us and has an open dependency on their 18th birthday and they're still in foster care, then it will cover them up until age 26. Oh, thank you, amazing Katie. Katie is our program, one of the program admins, and absolutely amazing. Thank you for putting that in there. So for the unaccompanied refugee minor programs, y'all take a look. Katie Ferguson put in chat the link for the program and more information. So thank you, Katie, for the save as always.
Well, if there are no other questions, thank you so much, Nathan, and I'll take it from here just to share some next steps with our lovely attendees. Thank you all for joining us today. And the next steps with our webinar is we'll be having another webinar in January 2024, January 17th, and the topic for that webinar is basic needs for post-secondary education student services support, and it will be the same time from 1 to 2 p.m. And we will be sending out emails with more details about that webinar coming up. And we have our workshop proposals open for the 2024 conference. So we invite you all and professionals or people that you know that will be interested to hosting a workshop session at the 2024 Passport Conference to submit proposals. I will make sure to include the link of the proposal in my follow-up email with the presentation slides from this webinar as well. We also have the lived experience panel applications open as well. And all of that information will be included in my email. That way you can forward that information to any youth that you know have lived experience that would love to participate in our Passport 2024 conference. All of the webinar information will be available on our website a little bit later this week for you all to access. And if you have questions about the webinar or future topics that we'll be addressing, feel free to email us at our Passport email at collegesuccessfoundation.org. And yeah, if there are no other questions, just wanted to say thank you to all of you for being here today. And thank you to Nathan for providing this important training for all of us. And I will be sending out a post-webinar link as well. That way you all can access that with the email. Thank you all and have a good one.